Well, welcome to Inside Cottonwood. I'm Ron Corbin, Cottonwood City Manager, and we are fortunate today to have a special guest, a local favorite. We have our Chief of Police, Steve Gesell. Welcome.
Thank you. Thank you.
Well, we got a couple things we want to talk about today. I know that we're a little preview about what's going on in our community with the police force and drug use, unfortunately. I know coming up, I believe it's March 5th, we have, you'll be doing, April 5th, you'll be doing your annual report to City Council. So this is a good time to talk about the status of law enforcement in our community. And unfortunately, the other day, we had a sad day, but a good day, which we'll get into. But first, one of our community organizations that I think makes a difference is MATForce. And I believe you've been recently appointed on the board and helping out over there. Why don't you tell us what MATForce is and then tell us about a recent day in Cottonwood?
Sure, and we're very fortunate to have an organization like MATForce and led by its executive director. Many people know Marilee Fowler, just a phenomenal asset to our community, countywide. But MATForce was formed, I want to say, it was way before your or my time, probably 15 years ago.
Wow.
And the acronym, it's not really an acronym, but MATForce was a group that stood up to combat the methamphetamine epidemic that was going on at the time, that was absolutely a scourge to cities like Cottonwood, and helped transform that culture. And we certainly did a lot of positive things, tamping down the methamphetamine use, and you can see it today in the community when you look at it.
So that board does a lot of good education, trying to continue to reduce substance abuse in our community and keep their finger on the pulse of what's going on with drug abuse and overdoses and those kinds of things in the community. So what's been going on recently? Sure,
yeah, and it's the metamorphosis has kept that moniker, but we, as an organization, address polydrug use, and it's a drug education and abuse education group, and it's a national model. Quite frankly, it's we just got a state grant. We're very, very happy to announce that we got a state grant to kind of extend outside Yavapai County into the state. We have a couple of events coming up. I want to make sure people are aware that March 21st through the 27th is Stand By Me, Be Drug Free Week. And also we have as part of that, we have our mile walk at Mortimer Farms on the 27th of this month at 10 a.m. And all that information can be found at matforce.org.
So again, a lot of education going on there. Chief, you used the word polydrug or polyuse, what are you referring to?
Well, obviously drug use and trends ebb and flow through time. I've been in the policing business almost my entire adult life, almost 32 years. And I've seen during my tenure in policing kind of trends, and most people notice those trends even certainly outside of policing, but the different drug of choice changes depending on supply and demand, depending on the new drug on the block. So MATForce has been very adaptable in that way, focusing on those trends and addressing drug abuse comprehensively as a whole, and helping educate parents and our citizenry, quite frankly, on the dangers of drug use.
Well, drug use is dangerous. The other day here in Cottonwood, I got a report from your department talking about 3 overdoses in one day. In my safe little bubble that I live in, outside of the drug world, I don't have to see that as much as our officers and you guys do. Luckily, I believe all 3 survived. Why don't you talk to us about that, about what's going on in our community? Seems kind of high to me to have 3 in one day.
It is, and it was very alarming. And a segue from the trending, the greatest concern we have in the current drug trends that's happened over the last, I want to say 3 years, has been the propagation, if you will, of fentanyl, which is a dangerous, dangerous synthetic opiate that is manufactured almost exclusively in labs in China and then is smuggled through our country, through our southern border by the cartels. Very, very dangerous. You may have, I know you have seen some of the press releases on some of our seizures, even in Cottonwood, of loads, quite frankly, that were being transported through our county. One seizure, we seize enough fentanyl to kill 500,000 people just in that one seizure. It's a very, very dangerous drug. The addictive qualities of it, it's similar to heroin. Many times it's mixed with heroin. And we are seeing just a rapid escalation of overdoses, not just in our county, but throughout the United States. And about 40% of the overdose deaths in our county and state are fentanyl related. Very, very dangerous substance. So, I'm sorry.
No, go ahead.
I didn't answer your question. So the other day, last week, we had 3 overdoses. We all believe they're fentanyl related through pills. You do not know what's in these pills, and these were not injected as far as the information that we have. But this is not controlled in a lab. These are made, many times in roughshod operations and thrown together, and you really don't know what you're ingesting. The kind of silver lining, and I say kind of because I'll touch on that, is the access to naloxone or Narcan is widespread now. All of our officers carry it. In fact, one of those 3 overdoses, all 3 of them were saved by Narcan or naloxone administered, which is primarily a nasal spray. These overdoses, basically you stop breathing as your respiratory system slows down so much where it just stops. So the naloxone gets that system jump started, and it saves a lot of lives. The other 2 were saved by naloxone. Someone that they resided with had naloxone, which was pretty interesting that we are to a point where this is almost something that as a prerequisite if you are a user of these very dangerous substances, to the point where some people are starting to ask the question, is this somewhat of an enabling crutch for your hardcore addicts, that they are pushing the limits to chase that highest high, knowing that they have the security blanket there. But it is very, very positive that those 3 individuals were saved, one by a Cottonwood police officer.
I think I'm very happy for the training our police officers have, and I know that we also have that Narcan in many other facilities. Hopefully we never have to use them, but very appreciative that our police officers provide first aid and are willing to do what it takes to save a life in the middle of a crisis and recognize what is going on. Very dangerous. So, kind of a sad day talking about that. I guess they live, so it's a good day. But so, what's going on in Cottonwood? Is there any trends that you can talk about, or was this an anomaly, or what's going on?
Well, as much as it can be a treat when we're talking about this subject, I do have some of the content of the 2020 Youth Survey, which is done statewide, and we do it in this county as well. So MATForce is the vehicle that gathers this data, and the report, our board just went over it a couple of days ago, and Marilee has given me the green light to touch on some of the data points and the trending that's mentioned in that report today.
So Chief, let me interrupt for a minute. So before you give any of the data, so this is I just want to make sure I understood right, a survey of young people, high schoolers, I'm assuming, young people in the whole state of Arizona, and what their use of drugs currently is.
Yes, adolescents as students. The test, as I understand it, is administered in class. So obviously this being COVID, some of the numbers, the response rate is lower this year, which I noticed. And I don't know what, if any, impact that will have on the data. There are some interesting takeaways from it, but the data, I should say, but yes, it's their report of their drug use, so it's all self-reporting.
Okay.
Within the last 30 days, they're asked a battery of questions to gauge their drug use.
Well, we're gonna have to take a break. When we come back, we'll hear from our chief of police about a report card, a self-reporting report card from the young folks in Arizona. We'll be right back.
This is Bruce Morrow, Transportation Manager for Cottonwood Area Transit. Remember, we cover the entire Verde Valley and Sedona. Cottonwood Area Transit has you covered wherever you want to ride in the Verde Valley, all day, every day. Take Cottonwood Area Transit through Clarkdale, Verde Village, and from 26 locations in Cottonwood. With Verde Links, it's a quick and easy trip to Sedona every day. Don't forget our connectors to Camp Verde. Visit cottonwoodaz.gov for Cottonwood Area Transit and take a seat. Let's go ride.
There are people who struggle with addiction and homelessness. Sometimes it may feel like there is nothing we can do to help.
But there is. You can make a tax-deductible donation and help those in need transition away from homelessness.
When you give someone a handout, you could actually be supporting an addiction.
A better life starts with better health, especially for those living in the streets.
Support solutions, not addictions. You can make a difference. Visit cottonwoodcares.org.
Gesell back. I'm Ron Corbin, Cottonwood City Manager, another edition of Inside Cottonwood. And we have this morning our Chief of Police, Chief Gesell. How are you doing?
I'm good.
Well, thank you for being here. Now, before we went on break, you told us about a Arizona youth survey on drug use.
Sure.
What did you find out, or what did the report show?
Well, again, this is all self-reporting, but let me just pivot to a little bit, as much as we can make this a positive contribution to this conversation. Just talk about real quickly some of the self-reported measures that kids feel help them stay away from using drugs. And a lot of this shouldn't be revelations, not rocket science, but certainly...
I'm taking notes, just to be clear.
Right. Engagement in school and extracurricular activities, that pro-social involvement, where they have that ability to interact with peers, interact with teachers, mentors, be socially active in a very positive way. Now, 2020, this has been very, very challenging for a lot of our youth. And we've focused, continuously on physical health, but certainly I think there's a greater awareness now on the mental health aspects and ramifications of the year's pandemic, particularly the restrictions. But certainly family involvement, we see that again, not a revelation. Right. Kids that are engaged, their parents talk to them about their daily activities. They talk to them about drugs. In this report, there was kids basically indicated that about 30% of the respondents indicated that their parents had talked to them about some type of drug use, be it prescription drugs. Alcohol was number one. There's a lot of conversations going on about alcohol, which is very, very positive and, quite frankly, a suit of armor for these kids. Risk factors are the converse of that, right? If the kids are not involved in school,
right,
they place a low value on their education. Their pro-social involvement, meaning any positive interactions they have, they're in theater at school, they're on a sports team, they're active in their church, any type of pro-social involvement. If that is lacking, that is another indicator that parents should take a look, keep a lookout for.
So before you go on, I want to just ever briefly, Yavapai County schools are back in session, I believe. it's just another tidbit that how important it is that we create opportunities for children to have social engagements that are safe, that are active. One of the functions of city government, in my opinion, is to provide opportunities for what I call connections.
Right.
So whether it be our library or our rec center or our Parks and Rec program or our Easter programs that'll be coming up, the city does have a role in helping out with that, but parents can't substitute parents. Involved parents asking questions, probing, being involved, and allowing kids to interact with each other. That's pretty big advice. It's not as common sense as you'd always think it is, but it is important that we give our kids an opportunity to be together. So very excited to hear that there is something we can do. All right, so what'd you find out?
So why are these kids using drugs? So we asked them in this instrument, and essentially it was very interesting because the choices or the responses that they gave were pretty much even keel across the board. And I jotted some of them down here. And again, these are chosen pretty much equally across the board. Fun, to have fun, to feel good, stress from school, stress in the family, and sadness. And it's worded as sadness, but I would couch that as depression as well. Yavapai County, our statistics according to this survey, the 2020 survey, very, very close to the state in many of the categories of drug use for our youth. But on the flip side of that, it's very, very interesting because they're asked why, if you haven't used, and let's celebrate, because there are many, many, many of our kids that choose, this is not for them. This is not for them. And we get kind of myopically focused in, the use part, but we fail to celebrate. There are plenty of kids that are out there as role models making the right decision. They were asked, why don't you use? And the answers were pretty even keel across the board. They weren't interested. They felt it would harm them, but this one's very important, I thought. Very high, it was number 3 out of 5 or 6. I'm sorry, at least 6, but it was ranked very high, and they did not want to disappoint their parents. So again, that parental involvement, very, very important. Be involved in your kids' lives, as I think that one is certainly key to keeping your kids away from this kind of stuff.
So, goes back to family, household, caring and being involved. So as we talk about Cottonwood, you're going to be doing a report to council here very soon about last year's efforts on the police department and trends in Cottonwood. Is there anything you want to share with the community before we get in front of council? Was there any aha moments for you as you looked at your annual report and you looked at the numbers?
We were expecting something to be wildly different, and there was some predictable outcomes. Residential burglaries, for an example, those numbers dropped precipitously.
Was that because they didn't want to get COVID? I mean, they didn't want to go to a stranger's house without a mask on?
Yeah. Burglars generally don't want to burglarize a house where there's someone at home. So that's
everybody was at home.
Exactly.
All right, I'm a little slow in the morning, so I'm sorry about that. That makes sense now.
A lot of people were at home this year, but it would be interesting for our audience if I touched on some of the overdose trends.
Okay.
Another facet of MATForce there is an Overdose Fatality Review Board. It's one of few in the country. And again, although this county experiences drug addiction and our drug problems, social problems rooted in drug use, just like any community, we are proactive to the point where the MATForce model is being replicated across the state and the country. I thought that's important to mention. But out of these reviews of overdose deaths in the county, and this is also in the report as well, last year, pretty alarming, there was 82 overdose deaths in the county.
Wow.
Okay, so to give you some perspective, in 2019 there were 68. Back in 2017 there were 40. Now, of that 82, half of those, roughly half, were fentanyl related. So very, very alarming, the increase. And that corresponds with the 4 to 5-fold seizures nationwide of fentanyl. So the demand is there, and the supply keeps coming. So the other, about 65% male, 35% female, which is, in my experience, the numbers of females continues to slowly creep up, even though it's still disproportionately male. One of the most sad takeaways from 2020 is the deaths and the overdose deaths in the 14 to 19 category, with 5 overdose deaths of teens, all fentanyl related.
Chief, so we have to take a break. So we'll take up this conversation when we get back. It's just heartbreaking. We lost 5 young people, and not even in their prime yet, still in high school age or younger, to fentanyl. That's what you just said, to one drug. Very sad. But so when we come back, we'll take up with that, and then we'll talk about, again, some things that parents might be able to do and some upcoming MATForce events so that the community can help make a difference. Again, inside Cottonwood with our Chief of Police, Chief Gesell.
This is Bruce Morrow, Transportation Manager for Cottonwood Area Transit. Remember, we cover the entire Verde Valley and Sedona. Cottonwood Area Transit has you covered wherever you want to ride in the Verde Valley, all day, every day. Take Cottonwood Area Transit through Clarkdale, Verde Village, and from 26 locations in Cottonwood. With Verde Links, it's a quick and easy trip to Sedona every day. Don't forget our connectors to Camp Verde. Visit cottonwoodaz.gov for Cottonwood Area Transit and take a seat. Let's go ride.
There are people who struggle with addiction and homelessness. Sometimes it may feel like there is nothing we can do to help.
But there is. You can make a tax-deductible donation and help those in need transition away from homelessness.
When you give someone a handout, you could actually be supporting an addiction.
A better life starts with better health, especially for those living in the streets.
Support solutions, not addictions. You can make a difference. Visit cottonwoodcares.org.
Welcome back to Inside Cottonwood. I am Ron Corbin, Cottonwood City Manager, and we have with us today our Chief of Police, Chief Gesell. Good morning again.
How are you?
I'm doing good. So we've been talking a lot about MATForce in Yavapai County and the efforts they're taking to reduce dependency on drugs and educating our community. You mentioned something about there's an overdose fatality review board.
Yes.
Who sits on that, and how often does that meet? And then let's reiterate or restate some of the more staggering, heartbreaking results that you had from your last review board.
Great question. So the composition of the Overdose Fatality Review Board is it's comprised of law enforcement. Obviously, it has a presence on there. I sat as a member for a number of years. Certainly, the treatment providers are represented on there. There's pharmacy industry, probation is represented. MD, obviously, the doctors are represented. County Health is represented. It is a pretty eclectic group, and we try to take a holistic look at each individual selected case and try to extract takeaways from these tragic overdose deaths to try to find fixes either in systems or trying to move our society in a direction so we can reduce some of these tragic deaths.
So you said the board is partially made up of service providers. One of my favorite in the community, and I guess as a city manager, I'm not supposed to pick favorites, but love working with Spectrum Healthcare. And I know that they have a crisis team that responds to calls, 911 calls. They recently opened up a men's inpatient care facility to help with substance abuse and other issues. What's your experience working with Spectrum and other service providers here in Cottonwood?
It's nothing short of phenomenal. When I was, right after I got here, I was trying to take a look at what partnerships we needed to establish and programs as a product of those relationships have really prospered. And Spectrum was one of the very first meetings I had with April Rhodes, dynamic lady, the CEO of Spectrum, and a completely invested in the community. That, I believe that's her personal philosophy, but certainly that's Spectrum's as well, and not just in word but action. So since that time, as an example, Spectrum has a mobile crisis unit, and that mobile crisis unit works hand in hand with first responders, particularly law enforcement. We are let's just say we're one of their most frequent customers on this side of the mountain. And we're very fortunate to have them as a partner, because many times the justice system becomes kind of the last ditch resolution for very complex issues that kind of skirt the justice arena, but could probably be better handled in the mental health or drug abuse treatment venue.
Yeah, we love Spectrum. We're almost out of time. I wanted to go back to, I think one of our biggest problems right now is fentanyl. You've mentioned that. So is there anything parents should look for? Is there anything that parents can do if they suspect abuse?
Well, the first thing I'll say is these pills are absolutely, these counterfeit pills. Talk to your kids. Tell them never to ingest and put anything in their body. It doesn't matter what their friend says it is, because that's where the survey also shows most kids get access to these drugs, be it marijuana, any type of illicit drug, but including fentanyl. It's coming from their friends. So make sure that they know, do not put anything in your mouth, because it is killing people. This is not a scare tactic. Go to MATForce.org. There is this there's an alert on there on these fentanyl pills that you'll find on there. And then there's also a virtual reveal of the Fatality Review Board's findings from 2020 on April 14th at 10 a.m. Go to MATForce.org and get more information on that. But talk to your kids. Be involved in your kids. The recipe generally doesn't change. The world does. It's a very complex world right now, and far more complex than when you and I were running around on skateboards.
Or bikes. Skateboards left a rash in bad places for certain people at the table right now. But I agree. Get involved. Well, Chief, this has been enlightening. I appreciate you taking time out of your schedule to come and visit with us. And am I wrong to say that if you ever find yourself in crises, dial 911 and let us help sort it out and save lives?
Absolutely.
But thank you and your force and our community for working together to save our children and protect our community. So thank you very much.
Thank you, Ron.
All right, another edition of Inside Cottonwood. Again, I'm Ron Corbin, Cottonwood City Manager.